So you wonder, how do you know how much to use of your medical marijuana as a medicine? Because we're using this as an herbal therapy, there have not been long-term multi-center dosing studies. So the advice that I give most patients is to start at a very low dose, typically 2 to 5 milligrams per dose, 2 to 3 times per day, and increase that dose very slowly over several days until you reach a therapeutic dose. Most patients are going to find their therapeutic dose between 5 and 10 milligrams per dose 2 to 3 times a day. There are some people that are much more tolerant and will require higher doses, and there are other people that are less tolerant and will require lower doses. But the safest thing to do is to start low and go slow. I wouldn't increase my dose until I'd been on a stable dose for at least 3 days. So you start 2 milligrams a day, 3 times a day. You stay there for 3 days. If you're not seeing the effect you need, you increase to 3 or 4 milligrams 3 times a day. Stay there for 3 days. If you do not see the effect you need, you go up to 5 milligrams 2 or 3 times a day. If you're unable to obtain that therapeutic dose using this simple start low, go slow method, then by all means call me, call my staff, and we'll bring you into the office and come up with an alternative dosing plan to fit your individual needs. Remember, all patients are unique and all patients have unique needs. Some patients are going to be more tolerant and require higher doses. Some patients are going to be less tolerant and require lower doses. Also remember, even though no one has ever died from the use of marijuana, whether recreationally or medically, you can have negative effects. Negative effects can be euphoria, dizziness, anxiety, nausea, lack of balance. If you have any effects like that, remember they're dose related. Back the dose down until the effects go away. Remember, we want you to be successful in this journey. So reach out and let us help you.